And a fetal skull is different than an adult skull because the bones have not ossified completely. And these areas that are not ossified are called fontanelles. And you may have heard of them as the common name is soft spots. But the unossified areas on the skull are called fontanelles. And you know, when the bones come together, they form a joint called a suture. And they usually are non-movable. They're sinoarthrotic. But here, because you have areas that are non-ossified, this helps in the birth process, and also helps for the brain growth. And usually these are ossified completely by about 4 or 5 years of age, more or less, give or take. Okay, so there are 4 main fontanelles, and they usually, I learned them according to the name of the bones. They're easier, but then they threw in the positions. So here's your frontal or anterior fontanelle, and you have a sphenoidal or anterior lateral fontanelle, mastoidal or posterior lateral fontanelle, and then your occipital fontanelle or posterior. Okay, so you have your frontal, sphenoidal, mastoidal, occipital, or anterior lateral, posterior fontanelles. Any questions?
Are you going to include both names on the exam?
I don't know. I don't remember. I know I included the ones that I learned to add the bones of the skull. Because for most people, you're learning the bones of the skull anyway. So they oftentimes, it's easy to associate it that way. But they might have both. Okay, so here we're going to move to an adult skull. So you see that the unossified areas are ossified. There's no fontanelles. Sometimes there would be a suture right here on the frontal bone. But usually there isn't, but if there is, it's called a metopic suture. Metopic suture. Sometimes some people will have that. Okay, so you have your frontal bone, your 2 parietal, occipital, coronal suture, sagittal suture. And then when you look at the back here, you have your lambdoidal suture. Okay. And usually, somebody asked today, and usually I have the students, the skulls, learn them from all 4 surfaces: the anterior, the inferior inside, inferior underneath, and then from the lateral side is a good way to know the bones. Okay, so we use the same terms again: squamous, process, fissures, foramen, all that kind of stuff. Make sure you know every single thing on your yellow sheet, okay, even if it's not on the white sheet. It's the same procedure as before, okay, so make sure you do study that yellow sheet. Okay, so your frontal bone right here, you have the frontal squama is your forehead, superciliary ridges is where your eyebrows sit. You have a supraorbital foramen above the eye orbit, infraorbital foramen below the eye orbit, and then inside the eye orbit you have your lacrimal bone and duct. You have an opening called the optic foramen in which the optic nerve will pass through. Then you have a superior orbital fissure, inferior orbital fissure. The 2 nasal bones, and you have an internasal suture in between. These are your zygomatic bones, your cheekbones. You have a zygomatical-facial foramen, maxilla with your infraorbital foramen, intermaxillary suture right here. Inside the nasal cavity, you have your inferior nasal conchae, middle nasal conchae. There is a superior nasal conchae, as you know, but that's way up here and we won't see it. So we only see the inferior and the middle. We see our nasal septum consisting of the perpendicular plate of the ethmoid and the vomer. Alveolar margin of the maxilla. On the mandible, you have the body of the mandible, the alveolar margin, and the mental foramen. And then on the lateral side of the skull, you have your squamosal suture, temporal squama. Here's your zygomatic bone. And here's your external acoustic meatus, styloid process, mastoid process. This is the bump you feel behind your ear. This is the mastoid process. This whole thing right here is called a zygomatic arch. When you're on this side of the suture, there's a suture right here. When you're on this side of the suture, this is the temporal process of the zygomatic bone. When you're on this side of the suture, this is the zygomatic process of the temporal bone. Temporal process of the zygomatic bone, zygomatic process of the temporal bone, frontal process of the zygomatic bone, zygomatic process of the frontal bone. So it's named according to the bone it touches. Something process of some bone. Okay? Got that? And so, and then here in the mandible, you've got your mandibular angle, mandibular notch, condyloid process, coronoid process, mandibular ramus, alveolar process again. When you look at the inside here, this is part of the ethmoid bone with the ethmoid sinuses. There's a very sharp part of the ethmoid bone called the cristigale, and this means coxcomb. And this is the portion. I had a student who was training in the Army, and he had just finished a kill class. And so we were doing the skull, and he was coming back and goes, yeah, that's one of the things that we learned, you know, to ram this into the brain to kill someone, and which is a good way. And then another thing too, they were issued small little knives, and they were taught two ways to do with a knife. And one of them was to insert it behind the skull here and come in through the foramen magnum. And because it's so small and sharp, it would slip right in, and then you could just sever the spinal cord and kill the person very quickly. And the other one was to slide it between the ribs and go directly into the heart. Nice, that's where taxpayer money goes. But after all, they were in the Army, so it was interesting that different ways to kill people. Okay, but anyway, so you have your cristigale right here, and then it's surrounded by a cribiform plate. From what I understand, I do not play the game called cribbage, but if you do, there is apparently a board with a whole bunch of holes in it that you put pegs in. And so that's what it reminded early anatomists of, was a cribbage board, so they called it a cribiform plate. And there are the holes in there, and the holes are the olfactory foramina, with the first cranial nerve passed through. Okay? And here's your sphenoid bone. So your sphenoid bone, you have your anterior clinoid process, posterior clinoid process, dorsum celli, optic chiasm, hypophyseal fossa, sella turcica. The whole saddle is called sella turcica. Lesser wings, greater wings, foramen rotundum. And then right here is the petrous portion of the temporal bone. There's an internal acoustic meatus. There's also a carotid groove, which they don't label right here, which is right here. The brain sits in this portion of the skull, so you have your anterior, middle, and posterior cranial fossa. And then underneath this skull, you've got your incisive foramen, which is behind the incisors. Median palatine suture, this is where it doesn't close, you have a cleft palate. We saw the cleft palate. Transverse palatine suture, horizontal plate of the palatine process of the maxilla. Vomer, pterygoid processes, mandibular foramen, or mandibular fossa, where the condyloid process of the mandible sits. Then you have a number of openings: foramen lucerum, foramen ovale. I don't know if they show foramen spinosum, carotid canal, jugular foramen, occipital condyles. Underneath there is a hypoglossal canals, condylar fossa, foramen magnum, external occipital protuberance, nuchal lines. So, and then you have your styloid process, mastoid process, stylomastoid foramen there too. Okay.